Hey everybody, it's Barbara Cape, president of SEIU-West. I hope you're doing well. I hope that those of you who are able to get vaccinated are lining up and getting vaccinated. I hope the hell that you have good PPE at work. I know you're tired. I know that this has been going on well too long. But you got to know that SEIU-West is doing everything we can, not only to represent our members in the weird day-to-day stuff that happens, like grievances and issues with managers, but also putting forward a better way for healthcare workers to have access to the vaccine, putting forward a better way for the government to address, temporary wage issues, and really respond to frontline essential workers. And when I say that, I am not only talking about healthcare workers. We have members in the education sector who are at the front line. They are struggling with online learning and being there to provide additional support for their students. We have members in the group home and addiction treatment and daycare sectors that are really struggling to make sure that they have good PPE. They have the same staffing issues that everybody else on the planet is having right now. And they've been fighting for recognition for the incredible work that they're doing during this pandemic. So, sometimes we really focus on healthcare and it's a huge chunk of the response to the pandemic, but also it's a huge chunk of our membership. But we also have to take our eyes up and look at the whole picture of our membership and recognize that we're all struggling right now, and provide that support to each other. So we have done a massive refresh on our website, and we wanted to focus on the function of it being useful with your smartphone or with your laptop or your iPad or your desktop computer. And so you'll see a new website launching next week, and we'll be making some incremental changes as we go forward. So keep checking it out throughout the course of next week, and you'll see some really good function improvements, including, as I'm told by our PA&E staff, the search bar. So hopefully you'll enjoy that. We look forward to your feedback. We have OH&S training for our member leaders next week. And that's really a way for us to dig in around the occupational health and safety challenges that we're facing right now, making sure that not only are we holding the employer accountable, but also making sure that the rest of our coworkers feel protected, feel safe, and know that we've got their backs on the OH&S front. Now, we've had a couple of weeks so far. We have more weeks coming of delegate selection meetings, and these are held for our upcoming convention, which is on May 26th. But the delegate selection meetings are held for every unit that is entitled to more than one delegate to convention. And all of this information will be on the website under the events page. So you can see if your unit is having a delegate selection meeting, make sure you register for those so that we know that it's just folks from your unit who are coming to those delegate selection meetings. They're not super long. You come into a Zoom meeting and you get to hear some speeches from candidates, and then the candidates get kicked out and the delegate selection process begins. So it's super streamlined. It's really quick. And I encourage you all to participate, because this is how we govern our union. This is the people we elect to do leadership positions on our behalf. So I think it's important that the members of our union are participating in that process. This week was provincial budget week. And, I'm a pretty ready critic of this particular government, because, I don't appreciate that this government doesn't recognize essential workers and isn't doing everything they can to support essential workers, because they're not. This budget provided no answers to the multi-year stable funding that this group has been campaigning for, golly, I want to say 5 years. And multi-year stable funding means that community-based organizations and group homes and addiction centers can plan for the future and that we can bargain improvements for our members. The other problem that we have is in the education sector. And the education sector has really been challenged in terms of adequate staffing for education assistants, for bus drivers, for maintenance, for library technicians and administration staff. And this budget really did not address the funding allocation deficit that we've seen year over year, but it also doesn't address the new requirement for online training and schooling for our kids from K to 12. We're so short-staffed in this sector that there is one education assistant for 4 kids who really need hands-on assistance. And as parents have been doing online training, they know how exhausting mentally, emotionally, and physically this can be. But for education assistants, there's a new game in town, which is that they are being tasked with, personal care for the students that need it, or medication administration. Let's be clear, these are not healthcare workers, nor should they be required to do this kind of additional care. And last, but certainly not least, is the paltry increase to the healthcare system. It was like they didn't want to make eye contact with essential workers, and they hoped that we didn't notice that they just absolutely ignored the crisis that is in front of us in healthcare. So there was a campaign promise of 300 continuing care aides, and honest to God, that's not even enough. We needed 300 continuing care aides before the pandemic. We needed licensed practical nurses. We needed environmental service workers. We need maintenance and trades. We need cooks and dietary staff. We need more admin staff. We need more techs. We need more healthcare workers across the piece, and we needed it 2 years ago, 5 years ago, 8 years ago. There are over 300 facilities in healthcare in this province. So that effectively means 1 FTE for each facility. Is that enough for you? Is that enough for your patients, clients, and residents? I don't think so. So if you want to take a look, we have issued our press release on this, and we are calling for a better and stronger investment in the healthcare sector. We're calling for all essential workers to be priority 1 in the vaccination sequence. And so I hope that you'll join us. I hope that you will call the Minister of Health and let him know how much you want a vaccine, but you're not priority 1, so you have to wait your turn. Anyways, it's a bit long-winded, but I thank you very much. I hope you're taking care of yourselves. Talk to you soon.